Happy 10-year anniversary to Johnson Dermatology, and happy 15th anniversary to our beautiful couple here who celebrates their 15-year anniversary this week. The couples that stay together get Botox together, and so today we are going to inject them both with Botox, but I'd like to point out the differences in anatomy between a man and a woman to make sure that he stays masculine looking after his Botox injection and she stays feminine looking after her Botox injection. We'll talk about the beautiful woman first. As you look at her, she has a beautiful heart-shaped face. Her brows are nice and arched. They're quite even. Her forehead is very soft. She's got beautiful eyes here, and you can see her face tapers down here. We're not talking about doing fillers here, but if we were, we would want to make sure to give her nice cheekbones here and keep that dimensions to her shape. But can you make your mean face for me, like your thinking face? Do you mind? So can you see she's got, you can delineate her muscles, but they're quite small, and you can see her eyebrows stay arched. Can you raise your brows for me? So you can see she's got some motion there, and can you squint for me? So you can see her eyes kind of soften and get smaller when she smiles, so we're going to kind of get rid of those lines around her eyes. And so looking at her husband here of 15 years, even without him making the face, you can see his muscles right here. You may not believe this, but they're actually smaller than they have been before because he's been getting Botox for a while. Go ahead and make your mean face for me. I mean, you can definitely see those muscles there, and you can see his muscles are even stronger than hers. So we're going to put more Botox here in him than we are in her. You can see his brows kind of lower a little bit, but that's a very masculine and manly feature, so we don't want to change that. So we're really not going to give him an arched brow, but we want to keep that nice horizontal brow for him. Can you raise your forehead for us? You can see how dynamic his forehead is. So we're going to soften that without giving him that surprised arched look. So let's go ahead and inject you first if you don't mind.
You want me to squint?
Go ahead and squint for me also.
Okay.
Great. So I'm going to let you have a seat and lie on back and get comfortable.
And something that Dr. Sandy may not have mentioned that you guys may have noticed is the difference in the angle of the forehead. So men tend to have a more sloped forehead and women's foreheads are more flat, which sometimes men, when they have Botox, also need filler to help lift and support that large muscle. Because of that slope, when you relax that muscle, some men may notice their muscles not being in the right spots, and so they're not looking as natural. So a lot of times we'll put filler in men at the same time as we do their Botox to keep that sloped angle too.
The smell of alcohol for most men also bothers them. So let's go ahead and turn to me if you don't mind. And we're going to go ahead and inject. So breathe in and breathe out. There we go.
So I think what really sets Johnson Dermatology apart in terms of Botox and expertise is that if you went exactly by what the FDA has approved Botox for, you're only putting 20 units there in that muscle. And so Dr. Sandy and I have been injecting Botox long enough, and we do it so much of it that we really know that even though you guys are going to look at the same amount of Botox in the syringe, in the 40 units, it's going to be dispersed much differently in a male than we will in a female. And so this is what you guys are seeing here today.
I might comment that one of the first men I injected wanted to be injected sitting up, and I injected him sitting up, and he passed out onto my very pregnant belly. He was one of the first men I injected, and I'll never forget that. My son is now almost 16 years old, so I've been treating men with Botox for almost 16 years, and there is a big difference in their facial anatomy, and so that comes with experience and sharing, and so I thank all of the men who've let me treat them through the many years. And we're done. How do you feel?
I feel great.
Good.
Very easy.
You did wonderful.
I like the grapes.
Great. Any other comments?
No. Is it done?
We're finished.
Wow, that was quick.
So after treatment, we want you to make your funky faces for about an hour. That helps the Botox to go into the muscle. Try not to bend over or try not to rub it for about an hour.
Okay.
Do you feel okay?
Oh, great.
So we're going to let you
That's
sit
easy.
up, and we're going to treat your beautiful bride next.
Are you coming in? Would you like the grapes?
Yes, please.
Don't squeeze them too hard.
So now that we're done injecting our Botox onto Botox, it's the same thing, guys.
And remind me, do you like the arched and the lifted brow?
Yes.
That's the thing that a lot of women really like. It really feminizes their face quite a bit and opens their eyes, and
I like it also.
but not for you.
No, for her.
Yes, for her. Very Audrey Hepburn looking even before her Botox injection. Can you make your thinking face for me again? Your mean face? Great. And then can you scrunch again? Like you're staring into the sun. Beautiful. And can you raise your brows for me again? Great. So you can see she's very flat, and you can appreciate that slope that Nina was talking about. And so we're cleaned and ready to go.
And so the tapping that you're seeing Danny do is a distraction technique to your body, to your mind, to decrease the pain. It's called the gate theory of pain, and it works really well. And so Dr. Sandy uses a very, very tiny needle, so you guys probably can't even see it on the video. The muscle that she's injecting now is the orbicularis oculi muscle, which is a muscle that wraps around the eye, which is what lifts the eyelids. If you guys were watching earlier, when we were injecting Botox and talking about lifting the eyelids, a lot of studies are coming out now that show that Botox into this muscle can lift your brows 1 to 2 millimeters. And for those of you that are watching, if you're seeing that kind of bubbling up or what looks like a small bee sting, that dissipates within the next, few minutes. That's just the medicine, and it will move into the muscle. That's why Dr. Sandy was saying if you could just make your faces, that helps the Botox go into the muscle right where we want it.
You did perfect. Would you like to add anything?
Oh, no, it's already over. Doesn't hurt a bit.
Happy anniversary, you guys.
Thank you.
you.
Thank you.
Everybody, thank you for tuning in with us with our lovely couple. Botox is $10 a unit through the end of August, so hurry in, run, don't walk. Take care.